Hi, this is Nurse Angela, and I'm going to be educating you today on IV dosage calculations, how to calculate the flow rate in milliliters per hour. Flow rates, this is when we're given medication, an IV medication, via an electronic IV pump. It's in milliliters per hour. We want to make sure we're giving it just the right rate for our patients. If we give it too fast, they can have side effects. If we give it too slow, it might not work correctly. So think of Goldilocks and the Three Bears. We want it not too fast, not too slow, just right for our patients. First thing, step one, you're going to look for the total volume of that IV solution. So in this problem, it says administer gentamicin 90 milligrams mixed in 100 milliliters of normal saline over 90 minutes. Okay, so we're looking for our total volume because we're going to do milliliters per hour for flow rate. So here's our milliliters. So we're going to take that number, 100 mils. Ignore this 90. This is not part of our drug calculation problem. Second step, we're going to look for the time to administer that IV medication in hours. Okay, and here ours is in 90 minutes. So we need to be able to convert 90 minutes to an hour. So if you take 90 minutes divided by 60 minutes, because that's in 1 hour, it would equal 1.5 hours. So for these calculations with milliliters per hour, that bottom number has to be in hours. Let's move on to the next one. So step three, we're going to take that total volume in milliliters over the total time to administer in hours. So we have administered gentamicin 90 milligrams mixed in 100 mils of normal saline over 90 minutes. So I'm going to take 100 mils, that's my top number, my total volume, over the total time in hours. So it's 1.5 hours equals 66.6 mils per hour. And if we round it to a whole number, 67 mils per hour. Your instructors would let you know if they want you to round to the nearest whole number for these medicines, for their calculations, or if you're going to go ahead and leave it at the nearest tenth. A lot of times for our critical care medications, we program our pumps to the nearest tenth, like with heparin, insulin, dopamine, dobutamine, those kind of medicines. We will program that pump because it has to be precise because it's a critical care medication. When we are trying to convert times, it's easier just to memorize this because if you don't want to have to sit there and figure out how many minutes and divide it by 60, 15 minutes is equal to 0.25 of an hour. 20 minutes is equal to 0.33 of an hour. 30 minutes is 0.5 of an hour. 45 minutes is 0.75 of an hour, and 90 minutes is 1.5 of an hour. So definitely memorize this chart. It'll be super easy for you to calculate flow rates. All right, here's our next problem. We're going to give Zosyn 2 grams mixed in 100 mils of normal saline over 4 hours. So we want our total volume. That's our step one. So it's 100 mils. Our next step is look for the total time in hours. This one is over 4 hours. Okay, so that's our next magic number. We don't concern ourselves with the milligrams at the time for flow rates, for mils per hour. That's just a distractor right here. Step three, we're going to take our 100 mils, divide it by 4 hours, and our flow rate that we would be setting on the electronic IV pump would be 25 milliliters per hour. Okay, let's try another calculation. Here we go. We're going to calculate the flow rate in mils per hour. We're going to give ampicillin 2 grams mixed in 50 mils of normal saline over 20 minutes. And remember from our chart, 20 minutes was 0.33 of an hour. So here we go. We have our 50 mils. That was our total volume. And 20 minutes converted into an hour is 0.33. And once you get that, you get 151.5. If we're going to round, because this is 5 or greater, we could round this to the nearest whole number, 152 milliliters per hour. Just make sure you find out with your instructors what they want you to do, if you're going to be rounding to the nearest whole number or keeping it to the nearest tenth. Okay, let's try another problem. We're going to give 1 unit of packed red blood cells. It tells us our total volume is 310 mils over 3.5 hours. So let's look at how we're doing that one. We're going to give the total volume is 310 mils and divide it by 3.5 of an hour. Our answer that we get is 88.5. Because this number right here, the nearest tenth right here, is 5 or greater, we can round this up to 89 milliliters per hour. And then the patient would get this entire unit of packed red blood cells over that 3.5 hours. If you're not sure how fast to administer medications, we use our Davis drug guide, and we would look up those medications that we're getting ready to give IV piggyback, and it tells us how fast we can safely administer our medicines based on our dose. And we would look under IV infusion, making sure we get it as an intermittent IV infusion. I hope this recording helped. Good luck. And I do have practice sheets at the end of this video in the folder. You can access that under my IV worksheets in the IV folder. Thank you.